I'm Dr. Jay Huber, and I'm an osteopathic medicine physician. I'm also an internal medicine physician. I became interested in regenerative medicine quite a few years ago, and I've been doing it now for many years. More than 25 years of my career involved in academics, regenerative medicine, internal medicine, hospital medicine, private and hospital practices. This presentation is purely for information, can't be assumed to be giving you medical advice. We are hoping today to help you understand more about regenerative medicine and all of the aspects that can actually help improve your lifestyle, your pain, and possibly avoid surgical intervention if possible. Most of the people that see us come in because the pain in their knees are so bad that they can't do the things that they want to do all day, every day. They can't walk, they can't exercise, they can't lose weight, and they've even been told sometimes by surgeons that they can't have surgery unless they lose weight. And they're unable to do so because they can't exercise, can't walk, or do the things that they want to do. In the last 30 years, many medications that we use are unchanged and not very helpful. Pain medications typically mask your pain and can be very addictive. Cortisone injections typically are done frequently as well as they typically help for a small amount of time, but especially cortisone tends to worsen the joint over time, damages cartilage, damages the bone, and even has effects on people's diabetes and other medical problems. Most of the people also are looking to avoid surgery. The cost of surgery is out of pocket, typically $3,000 to $4,000. They don't want to spend the money, and they really don't want to spend the 6 to 12 months in rehab care that it takes to recover from a knee replacement. Sometimes we have patients that have severe disease, and we do refer some patients back to the orthopedic surgery for knee replacement. It's typically felt to be a last-ditch effort. We recently surveyed everybody that had a knee injection in our clinic. 97% of everybody that we surveyed reported reduction in pain and improvement in function of their knee. 97% of everyone improved. Almost 75% of everybody surveyed said that they had significant improvement in their pain and function of their knees. We deem that to be 70 to 100% improvement over baseline. So to reiterate that, 75% of the people that got their knee injected had 70 to 100% improvement in their pain and function of their knee. We have had incredible success injecting these products for knees. Most of the patients come in and say they have been able to improve their lives, are able to do things that they could not do previously, and are able to avoid undergoing surgical intervention, even those patients that come in with bone-on-bone degenerative disease. Regenerative medicine is the process of regenerating human cells, tissues, or organs to restore and establish normal function. So the question at hand is always, what is really a stem cell? Stem cells are primitive cells that we have had since before we were born. If you injure a knee, stem cells will migrate to the joint, self-replicate, and begin to reduce inflammation. Stem cells in recent studies have been shown to be signaling cells, and these cells will signal other cells and to repair themselves or to become other cells. In the case of a knee, replacing cartilage or bone. This occurs in not only joints, but in other tissues all over our body from the day we're born and throughout our whole life. The good news is our body has regenerative abilities. The bad news is, as we age, the strength and quality of our cells and our ability to regenerate declines quickly. When we're a newborn, 1 in 10,000 cells in our body is a stem cell. When you get to age 50, it continues to drop to 1 in 400,000 cells is a stem cell, and at that point in time, healing becomes very difficult. We have a very hard time in repairing bad knees, cuts, bruises, broken bones. Everything takes remarkably longer to heal, if at all. By the time we get to the age of 80, we end up with only 1 in 2 million cells is a stem cell. And so healing becomes very difficult. Repairing tissues, repairing joints, repairing injuries, repairing diseases is very hard to do. Hence the reason why we use brand new, only 1 day old cells from umbilical cords. Common question is, where do we get the cells from? And this is how this goes in every case. The stem cells are taken after a baby is born. There's no fetus involved. the placenta and the umbilical cord are being thrown away. When you throw the umbilical cord away, there's an option to donate it. Very many mothers now donate that placenta and that cord, and the blood bank and trained professionals can take those cells, wash them, cleanse them, store them, and put them through the same rigorous process that every other blood product in America ever goes through. And that tissue and that fluid extracted is full of one-day-old stem cells and growth factors. They're very safe, they have minimal cross-reactivity, they're easy to inject, they're potent, they're robust, and they're brand new. Is it safe to do? They are always screened for all of the common diseases, COVID, HIV, hepatitis, every other thing, and only the healthy cells that are 100% clean and would pass as red blood cells if you're in a car accident and need a blood transfusion. These cells go through that exact same process. Our clinic has never had an adverse reaction to any one of our injections. We follow the strictest infectious disease control guidelines, including the strictest COVID-19 guidelines in our office. Most people want to know, how fast does this work? You start to feel better in 2 weeks, 4 weeks, 12 weeks. These cells regenerate over time and continue to grow and continue to work over time, and our goal is to treat one time. Everybody wants to know, how much downtime is there? The answer is 0. There's no downtime whatsoever to this procedure. How long does it last? The answer is, we don't know. The real answer is there's multiple studies that show improvement from 24 months out to 7 years. And the reality is it's probably somewhere in between that you get 3, 4, 5 or more years of help from a single injection. This is another really great success story. This lady came in with bone-on-bone knee pain, and it was severe for 50 years of her life. And she was unable to do those common things again, like walking, steps, jogging, running, all the stuff that she really wanted to do. Here's a picture of a normal joint space on x-ray. As you can see between the lines, the joint space is wide open and there's plenty of fluid in there, and there's tons of space between the bone. On this next slide, you can see that on those sides where the red lines are, there's no space left, the fluid is gone, and this is, you can see the obvious cause of her pain. Where the red arrows are is exactly where we injected her knee. She came back at 12 weeks, and this is what she told us.
I've had knee pain ever since I was a teenager.
Okay.
And I've never been able to go up and down stairs, walk, exercise. I've always been not able to do any of those things. Very limited dancing. But with the stem cells now, my pain is, it's like a 90% improvement.
Excellent.
I can walk up and down the stairs, I can go for walks, I can exercise. I started doing Pilates, and my legs actually felt good, which is totally amazing. I've never had that. Never had that before.
Before the stem cell therapy, a lot of this stuff you wouldn't be able to do it, or else you'd have a lot of pain when you did do it?
That's right.
Okay.
Yeah. Well, I'd have so much pain I couldn't do it. But I'd highly recommend it. I think it's well worth it.
So as you can see, her lifestyle improved immensely. Her pain has improved. She's happier, she's healthier, she's able to do all the things that she wants to do again after suffering for 50 years. The next gentleman is a guy that has an athletic history his whole life. He loves to referee basketball, especially high school games. He's unable to complete a game because he's got terrible knee pain. This is his x-ray on the right with a normal x-ray on the left. The x-ray on the left has significant space and plenty of fluid between the bones. You can see on the right he has diminished space between his knee. He wants to be able to continue to referee, exercise, play basketball himself, and continue to be an athlete. He's middle-aged and doesn't want to be disabled because he has a bad knee. We injected his knee at the site of the red arrow, and here's what he had to say.
Well, it got to the point where it was hurt all the time. You know, in the last 2 years, it had hurt constantly. And then, like I said, I referee basketball, so that winter, getting through the season was agony. I just was chewing down pain pills.
Okay.
I had prescription pain pills. And
so then you decided you came into the clinic. You had one of our regenerative medicine injections in your knee.
Right.
It's been roughly how long since you had the injection?
Had the injection last May, so it's been 10 months.
Yeah. And how's your knee doing now?
Great. Really good. Like I said, I can do 2 games, not a problem. I am completely, at the end of the second game, I have 0 pain in it.
He now is off all of his prescription pain medications. He takes no anti-inflammatory medications. He can do 2 basketball games back to back with no problem and doesn't have any pain and feels remarkably better. This is our last case. This is a lady who couldn't walk across her living room. She came in because she has severe bone-on-bone pain, couldn't do almost anything she wanted to do. She couldn't get to the bathroom, she couldn't get up and downstairs, she couldn't do her laundry, and was told her only option is to have a total knee replacement. These are her x-rays. You can see the normal on the right. You can also see the significant loss of space between the bones on the left. At the site of the injection, we ultrasound, placed the needle, injected her, and this is how she responded over 12 weeks.
I was told that both knees were bone on bone.
Did you get
Yes,
surgery?
I was told that I would need to have both knees replaced.
So you went through a regenerative medicine program.
Right.
You had an injection in just your right knee.
Just in my right knee.
Okay, so what did you notice change afterwards?
Actually, I noticed within a couple weeks I was able to walk without pain, and I kept walking more and more and more with it. Right knee, I'd say, is about 90% better. We were on vacation in March. I had a few days that I was actually walking 10,000 steps.
Wow, awesome.
And now I'm averaging between 7 and 10, where before I couldn't even walk across my house and I wanted to cry.
As you can tell, she is now remarkably happy. She can walk up to 7,000 steps at a time without having to stop. Her pain is remarkably improved. She hasn't had any more cortisone. She takes no more pain medications, and her lifestyle is immensely better than it was. She avoided a long and complicated knee replacement and is happy beyond belief. Although we can't help every patient, it is very rewarding to watch and see how many patients we have been able to help improve their quality of life. This group of patients is from moderate to very severe disease, yet all of them had significant improvement in their lifestyles and their pain. Many of them believed that because they had been told that they had bone-on-bone or advanced disease, that surgery was the only option. We are happy to report that we've had a significant amount of them get remarkably better. This is considered an elective procedure. It is not covered by any insurances. If you look at it carefully, other clinics are charging about $8,000 for one knee. We charge $49.80 for one knee and $69.10 for another knee. Because of COVID-19 and our desire to help you be able to afford the procedure, we only charge $49.80 and reduce that to $39.84 for one knee and $69.10 for 2 knees and reduce it to $55.28. If you look at the out-of-pocket cost of a surgery, it costs you about $3,000 to $4,000 as well. So the cost in our clinic is very comparable to what would happen if you underwent a total knee replacement. You get 20% off, and we have financing in the office at 0% interest, and HSA accounts are a wonderful way to do this. We are super excited to be able to offer this service to patients in this region. This is new, novel, and innovative care that is the cutting edge of regenerative medicine in America and around the world. We are very happy to be able to provide this, and if you are a patient who is suffering from chronic knee pain, trying to avoid an operation, had a prior operation and trying to avoid a second operation, we would love the opportunity to discuss that with you and have the ability to avoid further surgical intervention, further pain, further loss of function in your life, and to make your lifestyle better. Please call this phone number and schedule an appointment with us today. We will be happy to discuss this with you. It has been a pleasure. Thank you for your time, and I look forward to meeting you in the clinic.